Well, hello, and welcome to the Edward M. Kennedy Institute for the United States Senate. I'm Emily Rapp, the Director of Democracy Programs here at the Institute, and I'm thrilled to welcome you here to this virtual conversation on the 15th anniversary of the signing, Senator Kennedy and the Affordable Care Act. Throughout his career, Senator Kennedy championed the cause of quality, affordable health care for all Americans, especially during his service as chairman of the Senate Health Committee. To mark the 15th anniversary of the signing of ACA, we are incredibly fortunate to be joined by the Senator's former Health Staff Director, David Bowen, who served for over a decade on Senator Kennedy's staff. As staff director, David led the policy development and negotiations for major health legislation, including the Affordable Care Act, the Genetic Information Non-Discrimination Act, and the Pandemic and All Hazards Preparedness Act. Following his Senate service, David served in senior roles at the Bill and Melinda Gates Foundation and Malaria No More. Moderating today's conversation is Julie Rovner, Chief Washington Correspondent with KFF Health News and host of What the Health, the outlet's weekly podcast on health policy news. Julie spent 16 years as a health policy correspondent for NPR, where she helped lead the network's coverage of the passage and implementation of the Affordable Care Act. Julie is also the author of the critically acclaimed reference book, Healthcare Politics and Policy, A to Z. We are honored to have both Julie and David here today for this special discussion on the history of the ACA's passage, its impact, and the challenges that remain around healthcare today. We look forward to questions from our Institute members and staff alumni community at the end of the conversation. Thank you for your support. And lastly, given the rapid change of pace in today's political environment, I will note this conversation is being recorded on Friday, March 7th. And with that, I'd like to hand it over to Julie to begin today's conversation. Julie?
Emily, thank you so much. I am so happy to be here for this. I can't believe it's been almost 15 years since the Affordable Care Act was signed into law. I was actually in the room. It was, I will say, very exciting. Here's what we're going to do. David and I are going to chat for 35 or 40 minutes, and then we will open it up to your questions. I will remind you when the time comes, but we're going to want you to use the raise hand function, please. And then we will open up your mic and you will get called on. As I said, it's a big honor for me to be here today. A little about my background for this discussion. I started covering healthcare on Capitol Hill in 1986. So while I didn't cover all of Senator Kennedy's efforts at health reform, I was there for his unsuccessful efforts at pushing through an employer mandate in the late 1980s and early 1990s, as well as a Clinton health care plan. And then I was there for his more successful efforts at passing CHIP and the Health Insurance Portability and Accountability Act, HIPAA. So I've seen most but not all of the work. David, where does your timeline fall in this very long and distinguished career of working for health reform under Senator Kennedy?
So I began in the fall of 1999 as a science fellow, as an incredibly clueless science fellow. I was fortunate enough to receive a AAAS, American Association for the Advancement of Science, which is actually currently organizing Stand Up for Science today, as this is being taped, fellowship to work on Capitol Hill. And I remember interviewing with the Kennedy office and being struck by how tough the interview was. David and Sibel and others, and it really made me want to work there because I thought, well, in addition to this incredible heritage, these are people who take the role of being a fellow seriously. And I remember my first day, I was told to come in around noon. I thought I would just sort of be shown where my tiny little desk and what was then called the pit would be. And then I sort of get familiarized. I had about half an hour of that. And then someone ran in and said, there's an amendment on human cloning on the floor. Write some talking points, do a briefing book. And I said, sure, what's a briefing book? So, you know, my first sort of relaxing day in the office, I was there till about 2 a.m. and I was photocopying and I was putting 3-hole punches in. And that's how you learn. You learn by doing and you learn by throwing yourself in. And then many years later, I had the enormous privilege of sitting in front of a blank piece of paper and sketching out the beginnings of what became the Affordable Care Act. And what an extraordinary privilege, to be in that place, to work with the colleagues I worked with the team that I worked with. And when you say Kennedy team, you don't just mean the people you're working with at that moment. There is an unbroken line of people that you learn from who've gone before you. Senator Kennedy never really got the memo that anyone left and wasn't working for him anymore. So you just sort of felt like everyone was part of it. And of course, the senator himself was simply extraordinary.
And I will say, as a reporter, I also had that feeling that there was this unbroken line. I don't remember who was working for the senator when, because I figured everybody I ever met who had worked or was working for the senator continued to be an URSAT staffer, if you will, because that's kind of how the place worked. So did the senator have kind of a guiding strategy for going into some of these big projects? Obviously, as chairman of the help committee or ranking member occasionally, there would be the routine work, things that Congress used to do, like authorize programs and reauthorize them. And then there would be these periodic big picture things, of which obviously the Affordable Care Act was one. Did you approach those differently than just sort of the standard legislative activity of the day, month session?
Yeah, I mean, to some extent, we were working on health reform from day one, but I can really count my kickoff on the ACA specifically from a very particular day. And I was with Senator Kennedy in his hideaway, and many of the people on the line will know what that is when I say that. But it was his personal office in the Capitol at this extraordinary view down the mall, and it was full of personal mementos. And it was a very, very rare occasion because something on the schedule had gotten messed up and he didn't have something else right away. And we had what was a real rarity, which was unscripted time. And it was in the middle of May in 2008. And we were just finishing work on genetic non-discrimination, on tobacco, on mental health parity, with other people leading the charge on those. And it was clear that was really sort of clearing the decks for what would be the big push. And we had time to talk, and he said, when we've got to, we talked about the Clinton process and how long it took. And I remember him clearly saying, like, I want my bill in on day one. The day we get back, I want my bill in. And leaving me in no doubt whose responsibility it was to get that bill in on day one. And he talked about, well, if Barack gets in, we can do this. If it doesn't get in, then we can do these other things, but we need to push for this. And he very clearly conveyed to me that what we needed to do was get the best bill we could that could pass. He had no interest in a statement that didn't pass, in something where you held out to the last moment for something that wouldn't get through. And I always felt that he was this extraordinary combination of, he was an idealistic pragmatist or a pragmatic idealist, and both of those coexisted. He wanted to make the most progress that we could, but make sure it passes. And I remember the date so clearly because I thought this would be the first of many conversations I'd have in the hideaway or in person with him. And I remember the date because it was a few days later that he got sick. And his ability to be back changed so much, although his impact and his sense of being this guiding force, and particularly on this get a bill done, never left, even though he wasn't around as much.
So one thing about the Affordable Care Act that was very different from a lot of the other efforts at major health reform is that the push started years in advance. Talk about some of the groundwork that went into getting ready for, what was going to be this big push.
Yeah, I mean, some of that, I mean, all the things that you mentioned were to some extent preludes. HIPAA, or as it was known in our office, HIPAA, was a prelude to that, and CHIP was as a prelude, and steps toward. The other big step, it was the Affordable Health Plan debate, which of course did not produce a bill. And had that passed, we would have had a very different and much more carved up kind of health market, that it would have been, I think, more difficult to do some of the reforms that we ultimately put in the ACA. So that was, I mean, it was rare that Senator Kennedy defeated a bill, tried to defeat a health bill. Usually he would work to sort of modify it. But that one did go down, and it enabled, I think.
Remind everybody which particular one you're talking about.
Health plans. It was a Republican bill of a couple of years prior that would have essentially allowed insurance plans from unregulated or less protective states to be sold across state lines, notwithstanding the wishes of the recipient state. So it would have created a very much a race to the bottom of fewer and fewer protections, fewer and fewer consumer choices, and it would have made the gap between the status quo and what we did in the ACA even more.
So one thing that I know also went on was that there were all of these sort of talks. I guess there were, I think I described it a few times as, industry suing for peace, that there had been so many efforts that had been tried and failed that perhaps this was a coming together.
Yes, we did a number of roundtables or an ongoing roundtable series with industry, with unions, with experts, with consumer groups, and they were valuable for really several reasons. One, I genuinely, I mean, no one had done. I certainly had not done a comprehensive healthcare reform when the last time this went round, my predecessor, the legendary David Nexon, who was just an extraordinary person to learn from, and both personally and professionally, and in terms of knowledge. I mean, I always felt like, oh, can I possibly live up to what David would have done in this circumstance? That we convened these roundtables, the strange bedfellows, or took various names. It had the impact of helping educate on where people were, but it also kept people engaged. It's very hard to come out and beat up on a bill that you haven't seen yet, and where you're actively being engaged in the discussion. And so I thought it was valuable. And there were other kinds of things that went on as well. There were Senator Baucus did some things. He did a white paper. There was a thing in the White House. I mean, there were lots of things going on. But for our process, there was these series of meetings in our committee room.
Where did the 2006 Massachusetts health reform bill sort of fall into the sort of inevitability of the Affordable Care Act? Obviously, this was something done by a Republican, Mitt Romney, who was then the governor of Massachusetts, and I think many people will have now forgotten. And I know Senator Kennedy was involved in that, even though it was a state program.
Yes, he was very involved in that through my colleague Stacey Sachs, who worked extensively on the federal side of that. Um, so where did it fit in? I mean, there in about October, November of 2008, the Senate had left to go on the campaign trail, and I had time to do something I hadn't had the chance to do since I took the job, which was go through David Nexon's files. And David, kept paper. There was a fair amount of paper in those gray boxes in his office and around the office, and I had been meaning literally for years to go through it. And so I did. And I ran into old bills from 93, bill drafts. I ran into, there were drafts of the Chafee bills, some of the Republican bills from 93. There was a lot of work on the Romney bill, or on, not just the Romney bill, but the Massachusetts bill. And then there were memos from 93 on jurisdiction, and all of the floor battles on jurisdiction. And all of those sort of had a role. I mean, when I was drafting our first draft for the Help Committee, I literally looked through the compiled Massachusetts laws. I looked through some of the 93 drafts. I looked through some state laws and worked with our legislative council, and obviously all the plans of Democrats and all of the heritage that we got. But sort of all of that was very helpful in putting things together and moving the bill forward. So it certainly had an impact.
Remind us about jurisdiction. I know this still confuses people. The comparable committee to the Help Committee in the Senate, it's the House Energy and Commerce Committee, but they actually have a lot more health jurisdiction than the Help Committee does in the Senate. What is the health jurisdiction of the Help Committee?
Oh, everything.
That's what John Dingell used to say about energy and commerce.
Yeah, just as Senator Kennedy didn't get the memo that people left, he didn't get the memo that there were things in health that he shouldn't pay attention to. So he had been integrally involved in forming so many of the programs that ultimately became finance jurisdiction. The the mandatory programs or most of the mandatory programs. But the way the jurisdiction played out, I mean, I remember reading these very, very detailed memos and the floor battles and the fights. And I had worked with my opposite number on the finance committee, Liz Fowler, for many, many years, and we had a great trust relationship, still do. I had with her what I recall as the polar bear conversation, because we'd been trading phone calls, and then it was over the Thanksgiving break, and I was at our in-laws in Arizona. We were actually at the Tucson Zoo when Liz called me back on my phone, and we were in front of the polar bears, and the polar bears were given these blocks of ice with meat inside, and they were the polar bears, trying to get the meat out of the ice blocks, and we were talking about committee jurisdiction. And, I said to her, look, I don't want to write the 2008, 2009 version of these memos about jurisdiction. I'm sure you don't either. And she absolutely agreed and said, we said, let's just get the bill. Let's get the best bill that we can. We'll let the jurisdictional chips fall where they may. And there wasn't, to the best of my recollection, any fight about jurisdiction. And I remember a meeting on the House side where the chairs of Ed and Labor and Energy and Commerce and Ways and Means were in the room, and they all said, and jurisdiction even more important in the House, because it's one of the few locations where you can actually have an impact. They said, look, we're not going to worry about jurisdiction. If to get this done means that we have to shift jurisdiction, this is actually Henry Waxman saying this, to shift jurisdiction out of our committee, well, that's what we have to do.
Very much not John Dingell.
Yeah, well, but it was this sort of feeling of, the spirit possessing you, right? That we are going to get this done, and we're not going to let the traps of the past get in the way of getting this done now. And some of the traps of the past were having a very, very long deliberative process at the front end, so that the gears didn't get into motion until, a year in, and some of the momentum had been lost. And some of the traps of the past were getting overly fixated on jurisdiction.
So the HELP committee held the first markup of all of the committees involved in writing the Affordable Care Act, and it set records for length. It went, a month? What was that like?
It felt like a year. It
I'd
was,
say it felt like a year covering it too.
yeah. It was a once in a lifetime experience because no one would ever do it twice. There was just a phenomenal amount of work to do for all of the incredible team, from our staff assistant who organized everything to the fellows, to the interns who were running around with bits of paper, to all of the all of the people on staff, Kavita and Kaya and Tom and lots of different people working literally night and day. I mean, people will say, look, we work night and day, and usually it's a figure of speech. It was not. In part because we were still literally writing. I mean, the old adage, we were building the plane as we were flying it. We filed our initial bill with a hole in it. There were things that we couldn't work out at the time that affected the score. And so we added things back in. We had literally hundreds of amendments, most offered by the Republicans, and we were actively sorting through to see which ones we could take. So I thought it would be, incredibly busy. And then early on in the process, Senator Dodd, who was chairing in Senator Kennedy's absence from Washington, and is an absolute unsung hero of this. He did extraordinary work, not only hard work well, but with humor. He said to me, well, why don't you get up there? And I'm like, what? And so he put me in the hot seat where I was there was the circle of the senators, and then there was a table in front of the chair and the ranking member, and that's where I sat all day. And then we spent all night going through the amendments, and then we did it again the next day. So it was long, but it had a number of benefits, I think, for our members. First of all, to their enormous credit, as you know, from most markups, people wander in, they wander out, you get quorum for 2.5 minutes and you vote, and then people leave. They stayed and kept quorum for day after day. I mean, they were reading other briefing paper, but they were there. But they were also focused on the bill. And so I think our committee members knew the bill better than, at least at that time, anyone else in the Senate. And they said when they went to the town halls in the summer, which were so disastrous for a number of members, they felt like, well, no, we could, oh, you say it's done, it did this. No, we had that discussion, does this and not that, and this is the reality of it. So it was an extraordinary event, and it's in what is now the Kennedy Caucus Room, what was then the Russell Caucus Room. This extraordinary moment in this incredible place, and you really felt like you were, because you were, right in the heart of it.
How long did you hold out the hope that it would be bipartisan?
Not very long at all. I personally, you always hope that it can be bipartisan, but none of the signs early on would indicate that there was a substantial chance of it being at least meaningfully bipartisan. I mean, Senator Snowe had her sort of, ultimately unproductive flirtation with supporting the bill, but it became clear that the Republicans, even if you'd handed them a piece of paper and said, this is the policy, they might have looked at it and said, there's some things in here. I mean, after all, we did take some fairly Republican leaning policies. This was not single payer. This was not Medicare for all. This was, would have been recognizable to John Chafee from 1993. So it was a bipartisan, I've said this before, I mean, it was a bipartisan piece of legislation. It just didn't get a bipartisan vote. We got the strong view that there was no way that the dynamics on the Republican side would allow them to accept a bill.
Mitt Romney's leadership on the original idea notwithstanding.
No Republican leadership or ownership or authorship on any policy was enough. I mean, we took amendment after amendment after amendment, much to the ultimate disgruntlement of Mitch McConnell, who asked his members not to do the same thing in finance because it was a talking point. It was true that we took, I forget the number, like 78 Republican amendments. So you couldn't say that we weren't listening or we weren't including Republican proposals, but they just weren't, given the dynamics on their side with the Tea Party. There was just no real possibility, I thought, that they would go for it.
So after the two committees, after finance also marked up their version, it went into the maw of the Senate Democratic leader, and came out a completely different bill. What were some of the things that you were sort of most pleased that got in, and some of the things that you were most sorry didn't?
The thing that I was most pleased got in was the signature of the president at the end. Had not happened, and that was the thing that we were aiming for. I mean, it wasn't really a maw in the sense that we were integrally involved, and Liz and her team and me and our team, we were involved and the White House, of course, in the merge, which was taking our bill and then the finance marked up bill, although they mark up as a conceptual markup, so there's more flexibility to write. And then also, interacting with the rest of the caucus. And just to go back to your previous question, I mean, even though there weren't Republican votes, the level of ideological diversity or political spectrum diversity between, Ben Nelson and Lieberman and Sanders and some of the others. I mean, we had to navigate a sizable spectrum of opinion. So that took an enormous amount of time and effort and, working with of various different members who had, non-committee members who had particular things that they cared about, stakeholders who, obviously cared deeply about it. So that was the process. And I liken the ACA process to a huge relay race where each of us sort of had the baton at different times. At the beginning, I think I had it because we went first. In that merge process, we were all involved, but Reed and Kate Leone were the ones who were really pushing things forward, and it needed someone to say, "Great, we're going to push forward. We're going to push forward." And Reed and Kate were really expert in getting that done. And Senator Reed brought a bill to the floor that in November that he knew he couldn't get off the floor. That we had a bill that we proceeded onto, knowing that we could not get the votes to get off it. And so our job and his job and the members' job was to work out what bill we could get off the floor with. And so that was the effort of November and December leading up to Christmas Eve when we had the vote.
Yes, Christmas Eve morning,
Christmas Eve morning, and
which
then
I remember very vividly because we'd had how many snowstorms in the previous week?
and who writes the scripts, right? You wouldn't believe it if this was a movie. So the blizzard comes down, and then there was a question of some members, being able to get out of their houses, and so there was, I think assistance provided to help members physically get in.
So those of us who covered the Affordable Care Act remember all the things that very nearly scuttled it, abortion mostly, pay-fors also. What were some of the success factors, though, in getting the bill through?
So, in that relay race, there were a lot of people who really stepped up extraordinarily from the president. And of course, Senator Kennedy was I think the I don't know, sort of spirit animal of the whole process. I mean, he was there in spirit all the time, and the number of times that his name was invoked in some of these meetings of, well, Ted's looking on, and we have to do it, and on the member level, and this sort of deep personal commitment. The president, of course, there were so many instances where he was being told that the smart play is to do something minimal, declare victory, and give it up. But he stuck to it. The House leadership, Nancy Pelosi, after the Scott Brown win, when the House sort of exploded, and then she shepherded them back to where they could pass the Senate bill, and then the what was called the sidecar. And Reid and Baucus and Dodd, I mean, everyone played a role. So I think that level of commitment to it was really important. And I think on the staff level, trust. We obviously stayed in touch with the House, but they had their process and we had ours. And we thought we'd sort of meet at the end in a conference, which it didn't occur. But on the Senate side, the three of us who worked together most closely had worked together for years and trusted each other enormously. And there were really, I mean, I hope you'll bear this out. I mean, we didn't leak. We were able to.
Yeah, it was really frustrating.
Oh, I'm so sorry. I was told that by Robert Pear, that we were able to say, well, of course, in those rooms, you say, well, maybe we could do this. And if that maybe we could do this got out, there would be people who would care about it, and you'd have less freedom to act. And so that trust in the process, which was really done by a relatively small number of people, was, I think, enormously helpful and enabled us to move forward. And I know that there were similar dynamics on the House side, but we were kind of on parallel tracks rather than interconnecting. It was hard enough to get 60 votes in the Senate, and I'm sure they had their own challenges getting it through the House. We thought we'd meet at the end more than in fact turned out to be the case.
Yeah, I will say one of my favorite sort of leak discussions came during the Clinton plan, when one of the Clinton aides explained, how this works is that there's something that's being floated that someone doesn't like, and therefore they go out and they call Robert Pear and they say, do you know what they're planning to do? And then immediately he writes a story and they go back to the principals and they say, well, no, of course we were never planning to do that. And that's how you kill it.
Yeah,
So.
and that's poison. You can't, you have to have some freedom to act and freedom to speculate. If only to say, look, let's quietly get CBO to score option X and Y and Z. And let's see what, CBO was sort of the silent partner in all of this too. Because everything that we did had to have a score, and then there was a commitment to offset the cost, and so that imposed its own rigors.
Talk a little bit about long-term care. I know this was something that the senator cared about a lot. It was my first big story as a cub reporter at Congressional Quarterly in 1986. Like, we're going to solve this before the baby boomers retire, right? Now it's 40 years later and still not.
Yeah, so that was really shepherded through by Connie Garner, who is an absolutely extraordinary advocate for people with disabilities, and she developed that. It was one of the few that was sort of its own kind of self-contained thing that was included in our bill, and it had a so it was actually one of the few things that I wasn't particularly involved in sort of looking in under the hood of it. Obviously Connie and I worked together, and we worked together to make sure that it was in, but it was hers to build. So the judgment was subsequently made that it wasn't something that Congress felt could go forward, and it ultimately got repealed. And so there's still a solution to be had for long-term care. It's going to be, I think, one of the many sort of ticking time bombs of the future. Sort of underpowered, well, if we get that far, underpowered retirement savings being increasingly hoovered up by healthcare costs or long-term care costs. That's a serious issue, which deserves a serious solution. And I'm sorry that class is not part of that.
But I would think its inclusion, in at least at the beginning, in the part of the bill that got signed and got through, was
Yeah,
basically due to Senator Kennedy's
yeah,
original pushing, and then ultimately, his legacy, right?
absolutely.
Yeah. Um, well, as Nancy Pelosi predicted at the time, now that people have found out what's in the Affordable Care Act, it turns out they do like it, even with the Supreme Court having fundamentally restructured the Medicaid part of the law. It still now covers around 40 million people, counting both the marketplaces and the Medicaid expansion population. What's worked the best, do you think, as the ACA has matured, and what has worked not as well as you had hoped or expected?
Yeah, I mean, there were a number of things that have been somewhat surprising. I mean, I would say we always figured that there would be opposition to it. I kind of personally thought that it might go the way of Medicare, where there was huge opposition in 1965 and 66, 67. It sort of tailed off. It has begun tailing off now for the ACA. It took longer than I had hoped, and I keep thinking that if Senator Kennedy were out there making the case to in union halls and in meetings of the cancer patients, and he had such a gift at making policy relatable in a fundamental way to people. I think that might have been accelerated. But I think some of the things that have been really interesting to see is the changes in attitude towards two things. One is, it's hard to remember now, but when we did it, banning pre-existing condition exclusions was actually controversial. Now everyone sort of says, "Oh, of course you shouldn't be banned for pre-existing condition." Why don't I always thought that it's like pre-ex was like saying you couldn't go to a restaurant if you were hungry, right? You can't get health insurance if you've been sick. I mean, it's insane. But that used, and now everyone else, or most people seem to, oh yeah, of course, well, we can't have that. That has been a fundamental sea change in the way that people view the relationship between insurance and the insured or the covered. And Medicaid has also had a real, I think, sea change in attitude. I mean, it used to be sort of, oh, Medicaid, and that was sort of not something you talked about. Now Medicaid has just become, because it's expanded, it has become so much part of the weird, unique American healthcare structure that it will be very, very interesting to see what happens with these, with Medicaid in the budget negotiations that will end, potentially New Year's Eve this year, right? Maybe they'll do Christmas Eve, um, because it has taken root in a significant way. AC is sort of smaller things, more for the aficionados. Like ACOs have really taken off, which I think is great. And yeah, there haven't. I mean, Obviously, some of the rollout and the implementation was fairly rocky, I would say, in terms of things that didn't quite, light up the way they should have. The initial rollout was obviously had some issues to it, but those have been smoothed out, and I think it is now almost getting to the point where it's hard to imagine just completely uprooting it. Now, will we see the continuation of the ACA subsidies? Probably not. So almost certainly not in their current incarnation. Notwithstanding the fact that a lot of Republican voters are recipients of those subsidies. So, I am. I wasn't joking when I said the biggest thing on the bill for me was getting that signature. I think there were so many cases where we were heartbeats away from losing it, whether that's at the Supreme Court or whether that was in some of the deliberations where it seemed like we could. I mean, getting to about 55 was relatively straightforward. Getting to 60 was a big challenge. And there were a couple moments where we thought we were stuck on 58 or stuck on 59, and it looked pretty tough for getting to 60. It was like those old, Saturday morning shorts where, the hero would be left hanging to the railroad tracks of the train coming. You think, oh my God, how are you going to get out of this? And then, oh yeah, look, here's it's enhanced Medicaid match, and oh here's an OPM plan that helps alleviate some of the issues that we're having with a certain senator. So we made it. Best.
So, I mean, it does seem like the Republicans, and they're talking about Medicaid cuts, and they're talking about not renewing the enhanced subsidies. But one of the things they don't seem to be talking about is a full scale repeal. Is the law finally? Is it Medicare? Does it go in that list yet of the third rails?
If we say that, I'm too much of a superstitious Irishman to ever say, "Oh, things are fine," because that's when the famine comes. So no, I would never say that it's safe. I think that it is an ongoing responsibility to guard progress and continue on it. I think the Medicaid debate will be. I mean, one adjective is interesting, another one is dispiriting. Apparently there's been $880 billion worth of fraud and waste and abuse in Medicaid that no one knew about. And I had thought that the committee's head Republican chairman, and perhaps if there had been so much waste, fraud, and abuse in Medicaid, they might have found it. But now all of a sudden there's so much that we have to cut. And people are going to lose their health care to pay for tax cuts for the rich. There's no way to sugarcoat it, and it shouldn't be sugarcoated. It's appalling. And sort of parlor game for those of us on the Kennedy staff, or imagining what he would be doing if he were here. The repudiation of so many of the values that he worked so hard to move forward is really extraordinary. And I think, I joked with you in the prep that, one leading theory is spontaneous combustion, that you just, the level of outrage would be so high. And this, just on the health side, the idea that you're going to be cutting needed health care for people, 41% of all births covered under Medicaid. What sort of a pro-child, pro-life agenda can you possibly have if you're cutting back on that in order to pay for tax cuts for people who are the most well off? And that battle is, it's why there are protests, and there are going to be more protests around the country. These are absolutely fundamental stakes.
Well, I'm going to turn it over to the audience shortly. So if you have questions, please use the raise hand function and we will call on you. I have another question though for David in the meantime. One of the things that the ACA seemed less successful in, it was very successful in getting people covered, seemed to be less successful in actually lowering the price of healthcare. What's the biggest challenge going forward in actually addressing that part of the law that it didn't quite manage to get everything done. I mean, in fairness, Congress repealed most of the things that would save money because they were not popular. Is that the challenge?
It is a challenge because every time you talk about reducing the cost of healthcare, it means someone gets paid less than they are getting paid now. And so it's not as if you can sort of wish away spending and have it not affect anyone. So you can I think you can and should try and do things that reduce costs while maintaining care. I mean, I will sort of the flippant comment. It's really easy to reduce healthcare costs. You just pay for less healthcare, and people don't do as well. The real challenge is spending less and getting the same. I mean, it's been a while since I've looked at the graphs, but I know that we were bending the famous cost curve. So the level of increase has been less. I think some of the measures that were in there, like ACOs, have helped bring a greater concordance between the level of spend and the level of outcomes. But yeah, I mean, there were other things that were savers that have been repealed. And the reason for that is that, things that save money mean by and large that people get paid less for things that they're getting paid more for now. And regardless of what that is, those people have a voice, and those people it's lost livelihood. So these are tough things to do.
And they tend to have lobbyists in Washington.
They've been known. Yeah, I've heard that healthcare stakeholders sometimes employ lobbyists.
Yes, and they email me constantly, and I imagine others too. All right, we're ready for some audience questions. Carson, will you go ahead and open up the line?
If you'd like to ask a question of our panelists, please select the Raise Your Hand button at the bottom of your screen. We will unmute your line, call your name, and you can ask your question. Philip Caper, you've been unmuted. Please go ahead and ask your question.
Okay, I'll tell you who I am first of all. I worked for Senator Kennedy from 1971 to 1976. The reason I joined the staff as one of the few physicians who were on the congressional staff was because I liked the Health Security Act, which was the only real single payer that's been introduced to the Congress as a serious bill until Bernie Sanders came along. But I think we have to see what we can learn from and I think there are things to learn from this experience that involve both the politics, which is the biggest problem in getting an improvement to the Affordable Care Act, but also because the Affordable Care Act is based upon a faulty premise, and that is the use of markets to control cost, assure quality and access. And that doesn't work because in order for a market to work, the consumer, we used to call them patients, the consumer needs to have some power. And the consumer has very little power because of the huge gap in information between the sellers, who are the doctors and hospitals and healthcare companies, and the buyers, who are the patients. And that will never work. How do you think we can solve that problem without completely, I don't think diddling around with the Affordable Care Act is going to do it because of that fundamental flaw in the thinking. And I understand the politics, believe me, I do. And I think the politics are rooted in American culture, which involves this toxic idea of individualism, which is the idea that government is bad and taxes are bad, and government should be diminished as much as possible. And I think the American people are getting a lesson about what it means to diminish government, because that's what the Trump administration is all about. So how do we do that? I'll ask you, Julie. I don't think you were around when I was on the staff. I left in 1976.
No, I was in high school.
But we've met each other. And David, that was a very nice presentation about the mechanics of getting legislation passed. But how do you deal with with the problem of these fundamental cultural and ideologic differences?
Yeah, I'm happy to take a stab. Yeah, I mean, vis-a-vis the ACA, I felt that I had very clear marching orders from Senator Kennedy and unambiguous marching orders to get the best bill that we could get 60 votes for and a majority in the House for that could get to the president's desk. Is the ACA the most progressive bill that we could have written? No, absolutely not. I mean, one of the most fun bills I ever wrote was Medicare for All because it was unconstrained by that need to try and patch votes together because we weren't going to get those votes. So, there's sort of one level of response, which is what in the current climate can get, or in the climate in which we work, could have gotten 60 votes. And I think that we got, if not the best, then something close to the best bill that could pass. The other is, how do we fundamentally re-engineer the relationship and the social moment of the United States? I mean, that I think requires an expertise in sort of social movements and changing views, and it can be done. I mean, one of the most fundamental shifts in my lifetime has been the view of on gay marriage and related issues that when you talk about 1976, the attitudes were radically different, and there's still progress to be made, but it's possible to create societal shifts. It's very difficult, and it will take work, and I that's an unsatisfying answer, I think, Phil, but that's sort of the best one that I have, is that maybe it takes, maybe we're in such a moment of crisis too that there will be some fundamental shift in the way that people start viewing. It will make people actually start to think. It's nothing like firing, nuclear weapons inspectors or nuclear power plant inspectors and air traffic controllers and H5N1, epidemiologists to make people think, hey, wait a minute, maybe there is something to this whole government thing.
I was going to ask you that exact question. Is there a chance that the backlash from what's happening now could be such that there could be a sort of a shift in people's thinking? I confess, I thought at the beginning of the pandemic that might shift people towards thinking maybe we should have government healthcare, and obviously did exactly the opposite. So.
Yeah, I mean, having worked on vaccines for a while, I often said before COVID, well, the reason that there's vaccine skepticism is people haven't seen the diseases like measles, case in point, that we take vaccines against, and so you sort of build down your level of awareness. But in fact, we saw the disease of COVID, and it produced the opposite effect, and it shocked me and shocked a lot of people who've been involved in vaccine work.
Let's take another question.
If you'd like to ask a question of our panelists, please select the Raise Your Hand button at the bottom of your screen. We will unmute your line, call your name, and you can ask your question. Philip Caper, you've been unmuted. Go ahead and ask your question.
Well, I don't have a question, I have an anecdote. I remember having a conversation with Senator Kennedy in the early 1990s on his boat, the Maya, sailing from Nantucket to Hyannisport after we'd been in the Fagawi race, which was an annual race. And he asked me what my view was about adopting a more incremental. This was far long before the ACA, a more of incremental approach. And I said, I think we have to do that. I mean, it's clear that this sweeping change has to happen. And I've remained an advocate for a real Medicare for All program up until today. And I think that's the best and probably only way to achieve the goals of more coverage, a simpler system that's not so confusing for people, adequate cost control, which the ACA doesn't really have in it, because if it had it wouldn't have passed. So I'm not dissing anything that's done or trying to minimize the political accomplishment. But the ACA, we have to recognize, is not really very good public policy. You know, it helps a lot of people, but it also lacks in a lot of very important ways. And it's not for a shortage of resources. We spend about twice what other countries would have achieved that spend. And it's not that we don't know how to do it. The barriers are almost exclusively political, not technical, not resource shortage. And we have to begin to say that. And I wrote a paper in 1993 that was in JAMA, in which I proposed having Medicare Advantage for all. That's what it would be called today. And I believed that then. I no longer believe that, because the most important and salient effect of the Medicare Advantage program, that represents the largest shift of tax money to Wall Street in the history of this country, according to Don Berwick, and you know Don, I'm sure. He ran Medicare for a while. And so what I underestimated was the depth and the importance of greed in corporate America. There's no such thing as too much profitability in American capitalism. And we have to begin to recognize that and call it out for what it is.
David, I'm sure you read this in David Nexon's papers. One of the things that killed the Clinton health plan was the fact that there was this significant, on the Democratic side, support for Medicare for all. Obviously, there was still significant support for Medicare for all before the Affordable Care Act. How were you able to sort of overcome that and convince those people, the Bernie Sanders of the world, that that something was better than nothing?
Yeah, I mean, that was really challenging because you know, one of the hardest things to do is to take something that you might personally like and you know, try and say that look, the whole, you know, this has to, we can't get to the finish line with something that we want to actually have happen if we have this other piece on it. And you know, there were some deeply and rightly deeply held feelings about, you know, what was much less than what Phil was describing. Wasn't single payer. It was a you know, a public option, and even that proved impossible to get 60 votes for, and ultimately the you know, the more progressive wing on the Democratic side was able, with a great deal of you know, internal pain, to accept that a final bill on balance was better to go forward without a public option than not to go forward with one. And that's one of the things that I meant when I said Senator Reid brought a bill to the floor in November that he couldn't get off the floor. One of the things that wouldn't have gotten off the floor is the bill with a public option. I mean, it's a whole much longer conversation, which we won't have, about how the US healthcare system got to where it is, which is a function of wage and price controls in World War II. You would never, if someone said, hey, why don't you design a healthcare system? Well, case in point, I was in Japan a long while ago. We were talking to Japanese senators, members of the Diet, of the upper house of the Diet, and someone was talking about the US healthcare system. And that one of the members of the upper house said, very politely, but what actually somewhat less politely than is the norm in Japan, why are we even listening to you? The US healthcare system is terrible. You know, why are you talking to us? You know, you would not design a system this way. So, but we didn't. We weren't passing the bill in 1947.
True. Well, we have a question from David Nexon, who I'm so glad is here joining us. He asked, well, the ADA was a great step forward. I think he means the ACA was a great step forward. The ADA was also a great step forward. We are still short of Senator Kennedy's goal of that healthcare would be a right, not a privilege, meaning that financial barriers would not prevent anyone from getting the care that they need. And, oops, sorry. Not be financially burdened by that care. What are some of the steps that we should take now to build on the ACA to get closer to that ultimate goal?
I would really just, I wish David, I mean, maybe, I don't know if David will pop on. I mean, it's the sort of thing that I would love to hear David's views on.
Me too.
There's expanding the level of financial support. I mean, it does come down to money. There's sort of closing some of the coverage gaps. There's more, I mean, I think one of the big gaps is obviously the states that haven't expanded Medicaid, advocacy there. And then I mean, now, there are still defined and open gaps in where we have coverage. It will take will, it will take money, it will take, I think an interesting question is whether we need new structures or improvement of the existing structures. And if so, what are those new structures and can they get done? But David's absolutely right on this, as on so many other things, that there's still a lot of work to be done. And we have taken a step toward that goal of healthcare being a right, not a privilege, but there's still other steps to be taken.
Well, I'm going to turn this back to Emily in a second, but I get to tell my very favorite story about Senator Kennedy. At the end of when the Senate finally passed HIPAA in 1996, that, as was usual, the senators would all go to the Senate Radio TV gallery and give a little sort of, post-victory press conference. And I was walking to the elevator with him afterwards, and he turned to me and he said, "Whatever will you do with your time now that we finish this?" And I looked at him and smiled and said, "Senator, I am sure you will think of something." And I think that has stayed with me for the rest of my career in healthcare. There's still a long way to go. Emily, back to you.
Thank you so much, David and Julie, for a fascinating and timely discussion today. Thank you to all of our Institute members and our staff alumni community for joining us live. Your support makes virtual events like this possible. And to all of you watching the recording, we hope you will consider making a donation to the Institute or becoming a member today to help support programs like these. Stay tuned for additional virtual and in-person events throughout the year here at the Edward M. Kennedy Institute. Thank you so much.